Okay, so with food allergies, one of the common misunderstandings or myths is that food reaction occurs shortly after changing the diet, when in fact actually 70% of our food allergic patients have been on the diet for a chronic period of time. So they will have had that chance to develop the sensitivity and then develop the allergic reaction to it. The kind of chronologic coincidence where it happens as soon as you've changed the diet is probably more of an indication that you may have an adverse food reaction that is not immunologically stimulated. So these could be associated with an irritant reaction. Certain things like strawberries and lettuce have things like phenols in them, and they can actually stimulate or trigger an allergic reaction. There's food intolerances. People understand the idea of lactose intolerance. Same thing can happen in our pets as well, where they're fed a food that they just simply can't digest, and that triggers a food allergic reaction, whether it's gastrointestinal or skin signs as well. Thirdly, there's some of the preservatives, some of the, if they're chemical preservatives, that can actually trigger a reaction. So we call them drug reactions, basically drugs that are within the diet that might actually cause these adverse reactions. So usually they're chemical preservatives like BHT, like ethoxyquin. So those are the ones that we'd like to try to avoid in these diets. And then lastly, food poisoning. Food poisoning, I'm not saying somebody's gone ahead and poisoned your pet's food, but what can happen is there are things like mycotoxins that are basically formed from plant sources. There could be even bacteria like E. coli, Salmonella, Campylobacter that can also trigger kind of some adverse food reactions that are associated with what we would call a food poisoning. And so with these adverse reactions, those are commonly related to changing the diet and within a week's period of time, all of a sudden having an adverse reaction. And those are called non-immunologic conditions.